Hey, Dr. Deb Schreiben here. What's healthy? We are. Today, we are going to talk about stuff that nobody ever wants to talk about. Why? Because I like to talk about that stuff. We're going to talk about hormones and hormone therapy and the difference between traditional hormone therapy and bioidentical hormone therapy, because there is a huge difference between the two. And a lot of us women and men are going in to get some hormone replacement to help us with things like sleep issues, weight gain, hair falling out, sex drive is a lot of people tell you that and they don't even want to tell you that because they're afraid to tell you that, but it's everybody. I can't even tell you how many people as they age experience this stuff. Mood changes, grumpy wife. So grumpy wife is not a happy life. At least that's what we say in our house. So there's a lot of different symptoms that we experience when our hormones are out of whack. And a lot of you might not realize that as we age, our hormones will change. They will go up, they will go down. When you're pregnant, they change. When you get older, they change. When you have your period, they change. When you go through andropause, which is male menopause, they change. When we go to perimenopause, menopause, and postmenopause, all of our hormones tend to change. Now, there are a few main hormones that we're talking about, right? Estrogen, progesterone, testosterone. These are three of the most common hormones that people know about. We call these our sex hormones. And these are the ones that will typically change as we age. Although there are other ones like adrenals and thyroid and insulin, which is also hormones. Those will change as well. And so I would like to tuck that into the back of your mind so you realize that although I'm going to be talking about sex hormones right now, when we're talking bioidentical versus traditional, but there are other hormones in our bodies as well. So what we try to do when we are getting hormone replacement, or in my office, it's only bioidentical hormone replacement therapy, is optimizing our hormones. Now, there's a couple of different things that I think are really important to talk about. We get our labs done. And, oftentimes I have, especially women coming in and saying, hey, my OBGYN won't even test my hormones. They'll just give me a patch or give me a gel or give me a cream or tell me to do this without even seeing what I'm deficient in, just based on symptoms. I am super not in favor of that. That is dangerous. It is unhealthy. And then a lot of our regular doctors are just giving traditional hormones, which also can cause things like cancers, other health issues, and things like that. So we always want to test first. We always want to figure out where the imbalance is so we can figure out what we need to do to fix it. And this can be at any age. And this is super, super important. So if you're one of those people and you went to the doctor, they're like, here, just take this. I don't know. Optimizing our hormones can really provide relief for a lot of people, but we want to make sure that we are doing it in the right way. Now, how do we help optimize hormones, right? We do it through shots. We can do it through pellets. We can do it through gels and creams and patches and pills orally. There's a lot of different ways that we can do this. And I think, it's, again, going back to testing, really important to know what you want, because you can go through these tests and you can go, oh, you know what? And this is what typically will happen in the traditional world or the conventional medical world is, oh, hey, Jane, your labs look great. But you know what? This is the labs for someone who is 55 years old, who is 65 years old. Now, what we know is that our hormone levels change as we age, and our labs reflect that. So I don't know about you, but I felt better when I was younger. I felt better when my hormones were higher. And there's typically no problem having higher hormones when you're a little bit older. So for me, when I look at labs, I go, okay, wait a minute. Okay, yes, this is labs of someone who is 65 years old. If you want that, that's perfectly okay. But if you don't and you want to feel better like you did when you were in your 30s, then we want to get your numbers to levels that they were like in your 30s. That's the difference. So we're looking at a different range as well when we're talking about hormones. So then when we look at what we need for hormone therapy or bioidentical hormone therapy, then we know what our target is, because it may be different than what that conventional range is that showed up on your lab if you're a little bit older. Right? So traditional hormones, they are typically made from, horse's urine, chemicals, things like that, where bioidentical hormones are plant-based. They can be made from yams. They have far fewer side effects. They are much more effective. They are much safer. And people typically feel so much better on those. And our doctors don't typically tell you that there's a difference between hormone replacement therapy and bioidentical hormone replacement therapy. So I think it's really important. And with bioidentical hormones, we can actually individualize your care much, much better. Now, of course, as with anything, there are some contraindications. So if you have a blood clotting disorder, if you have heart disease, cardiovascular disease, if you had stroke or cancer, especially breast cancer, then you really want to be careful with any kind of hormone, even bioidentical hormones. So the good news is if you're one of those people that's struggling with any health issues, right? Sleep issues, hot flashes, night sweats, weight gain, mood issues, hair falling out, skin, getting acne when you didn't have it before, whatever, the erectile dysfunction for men, right? A lot of guys are going in and getting testosterone shots. We will often do testosterone troches, which is a plant-based little thing that looks almost like a little starburst that melts in your mouth. Way, way healthier. And for women, we only need much lower levels of testosterone. This is one thing too. A lot of people don't realize women actually have testosterone and men actually have estrogen and progesterone. They do. We have all of those, and we want them to be in the right amount. So we have all kinds of great choices when we're looking at bioidentical hormone replacement therapy so that you can feel optimal, get rid of all those icky side effects, and feel amazing again, just like you were when you were younger. And I don't know about you, but I want to look young and feel young and really be able to enjoy whatever years I have left in my life. So if you have any questions, don't ever hesitate to reach out and ask. You can always just give us a call, go on our website, whatever you need. I am here to help you through that bioidentical hormone replacement therapy journey. Hope this helps. Until next time, wishing you loads and loads of love and light and health and happiness. Bye-bye.